My name is Dr. John Wessling, and I would like to talk to you about migraine headaches. A migraine headache is a throbbing or a pulsating headache that is often one-sided and then spreads and builds in intensity over 1 to 2 hours and then gradually subsides. However, it can last up to a day and in some cases several days. There may be related symptoms to migraines such as nausea, vomiting, sensitivity to light, sensitivity to sound, sleep disturbances, and depression. You may even notice your hands and feet feeling cold and sweaty. Certain smells and odors may be intolerable, triggering a migraine. The most common type of migraines is with an aura usually affecting one eye, described as bright, shimmering lights around objects, zigzag lines, wavering images, or temporary vision loss that is experienced 10 to 30 minutes before the headache. Attacks are often recurrent and debilitating. Migraine sufferers are left feeling tired and weak once the headache passes. Any stress, routine physical activity, or straining can intensify a migraine, and sometimes they become so severe that it interferes with daily activity. Now, initially, it is best to get checked medically to rule out for any serious problem or pathology. Now, quite often, once any serious pathology has been ruled out, medications are prescribed and usually only give temporary relief and may make you feel better for a while, but the migraine will still be there when the medication wears off. Now, let's tell you why migraines happen. There are 3 parts to the brainstem located right here: the upper, the middle, and the lower brainstem. Now, normally the brain fires impulses down to the lower 2/3 of the brainstem, and that slows down the upper brainstem. Now, when a person has a really bad migraine, this doesn't happen. This does not occur. The lower part of the brainstem, into here, is not slowing down the upper brainstem. Now, the reason you have migraines is because this upper brainstem is hyperactive or overfiring due to the fact that the brain is not firing impulses down here into the lower brainstem, and this lower brainstem is not inhibiting or slowing down the upper brainstem, which is caused by some kind of stress, whether it be physical, emotional, or chemical stress. Physical stress could mean a car accident, a physical injury, a bump, a bruise, or even a fall. Emotional stress could be from work, an abusive or suppressive relationship, or even financial difficulties. Chemical stress could be from side effects from drugs and medications, or some metabolic or hormonal imbalance. Now, as a result from the upper brainstem overfiring, it causes blood vessels in the brain to constrict and get smaller and then dilate very rapidly. This rapid constriction and expansion of the blood vessels affects the nerve mesh that surrounds the blood vessels, causing the migraine pain. Now, nausea can occur from an overactive brainstem because the lower brainstem is not active. See, the vagus nerve comes off here and runs down here into the abdomen, into the stomach. And since there's not enough electrical energy from the brain to the lower brainstem, the vagus nerve will not be functioning properly. Therefore, you may vomit or become nauseated. Now, light sensitivity occurs because the 3rd cranial nerve coming off this upper brainstem that goes over here to the eye constricts the pupil. However, if the upper brainstem is overactive, then the 3rd cranial nerve will not constrict the pupil, and you will become light sensitive, and you may find yourself in a dark room until it passes. And in some cases, the cerebellum is not firing, which is located right here. And the brain is not firing into the lower brainstem, and this too may contribute to your migraines as well. Now, when it comes to treating migraine headaches, we take a different approach in our office. After a thorough neurological examination, what we tend to see quite often is an overactive or a hyperactive upper brainstem or a weak or malfunctioning cerebellum. Now, we use brain-based therapy to non-invasively evaluate and rehabilitate the cerebellum and brainstem, which is highly effective in the treatment of migraines. We also use clinical nutrition, urine and saliva and blood chemistry analysis to check for metabolic or hormonal imbalances. So often migraines can be caused by a poor diet or nutrition and a hormonal imbalance that we often take a close hard look at, because this may be the integral key to your recovery. Now, unlike most treatments, like medications, which usually only treat the symptoms, brain-based therapy and clinical nutrition actually treats the cause of your problem. So if you suffer from migraines or from chronic headaches, and you are looking for a doctor that will sit down with you to find out who you are, how you have been treated, and be able to provide some hope, then please fill out the area below for an online video that will explain all the different treatments that we do to make our care so unique and successful.